Is diabetes an incurable disease, type 2 diabetes? Should it get worse all the time as it usually does, or is that a symptom? Is that because we're treating it totally wrong or not even treating it at all? That's what I'm going to talk about with my guest today. I'm Andreas Enfeldt from DietDoctor.com, and I'm here with Dr. Jason Fung, a nephrologist from Canada. Welcome.
Oh, thanks very much.
So I just watched a presentation by you. I thought it was really fantastic.
Thank you.
It was about how we treat diabetics today in the medical system. And you're a nephrologist. You meet diabetics when they've had their disease for a long time and they're really sick, right?
Yeah, so I treat people on dialysis. That's a lot of what I do. And it's very disheartening because what happens is that when they develop their disease, they're so sick. But the diabetes itself is actually quite reversible. And that's one of the things that I realized a short while ago. And that's what needs to be understood, is that this is not a disease that needs to progress. But we often tell people that it's a chronic progressive disease. And that's not simply me talking, but if you go to the diabetes associations, whether it's the American Diabetes Association or the Diabetes Australia, they all put out there that this is a chronic disease. And they tell people essentially that you have diabetes, you'll have it for the rest of your life, you might as well get used to it. But the problem is that that's simply not true. And it's actually pretty easy to prove it, because if somebody came up to me and said, I've had diabetes, I was told I had diabetes, I watched my diet, I lost 50 pounds, I cut my carbs, I cut my sugar, and now they took me off of my medication, I'm fine now. That's obviously true. Nobody would say, oh, you're lying, right? So that patient who has lost the weight, who has changed their diet, has increased their exercise, for instance, their diabetes actually got better. And the thing is that if that patient got better, what happens to this idea that this is a chronic progressive disease? Well, obviously it's not true. Because any time that happens, every time it happens, it means that the disease is actually reversible. But you have to know how to reverse it. If you don't know how to reverse it, then you're just going to get worse. And the thing is that the drugs don't actually do anything for the disease. And this is also not controversial, because the thing is that type 2 diabetes is a disease of too much insulin resistance. And that's not controversial. Everybody acknowledges that, right? So if you have very high insulin resistance, it's going to cause high blood sugar, right? But that's the symptom of the disease. The disease is actually too much insulin resistance. So the treatments that we give are all targeted at blood sugar. Right? That doesn't make any sense, because it's almost like, to give an analogy, if you have an infection, if you have a leg infection, well, you need to treat that infection. So what was causing it was bacteria. You give antibiotics. But that infection can give you a fever, but that fever is not the disease. If you start treating that fever as if it is the disease, then that leg wound is going to fester, because you're treating the symptoms of the disease and ignoring the disease. But that's what we've done with type 2 diabetes. We're treating the blood sugar, but it's not a disease of the blood sugar. It's a disease of too much insulin resistance. So what happens is that because we're not treating the disease tends to progress. So if you look at what happens over a period of 10 years, 15 years, what happens is that you start off with one medication, then you take two medications, then three, then you take insulin, then more insulin, and more insulin. And after 10 years, you started with one medication, now you're on 100 units of insulin a day. Well, you're taking more medication to do the same job, to keep that blood sugar the same. That means your diabetes is worse. Even if your blood sugar is better, your diabetes is worse than it's ever been, because you've never actually done anything about treating the insulin resistance. So that patient who went and lost weight and exercised and cut out the carbs and cut out the sugars, they actually reversed their insulin resistance, and therefore their sugars came down. which is far different than making your blood sugars go down by force, by medication, and ignoring the actual disease. So that's the fundamental mistake that we've made over this last 20, 30, 40 years, right? We've treated the disease of type 2 diabetes, which is too much insulin, as if it was type 1 diabetes, which is too little insulin. So you got to understand that type 1 diabetes has too little insulin. So that makes sense. You should give them insulin. Type 2 diabetes is too much insulin. You need to reduce their insulin. But instead, we're giving more insulin to a disease state that has too much insulin. Well, of course, that's not going to work. That's crazy.
And you had an analogy there as well in your talk. You were saying it's like, that would be like treating an alcoholic with...
Exactly. So if you have a disease such as alcoholism, where it's characterized by too much alcohol, the very last thing you want to do is give more alcohol. And that seems very obvious, right? But if you look in the short term, as you take away the alcohol, they might get the shakes, they might get delirium tremens. If you give them alcohol, they will feel better in the short term, right? But that doesn't mean you're going to make the alcoholism better, right? That's the real problem, is the alcoholism. You can't treat the short-term thing at the expense of the long-term. What we've done is treat the short-term. We said, wow, your blood sugar is high, let me get it down, right? But it's like, well, what's happening to the disease? Who cares what's happening to the blood sugar? What's happening to the disease? It continues to get worse. So it's just like that alcohol. Too much alcohol. The disease is too much alcohol. The cure cannot be to give more alcohol.
Right. So to be clear, giving insulin to a common type 2 diabetic is like giving alcohol to an alcoholic.
Exactly. So the disease is too much. It's insane. In fact, it's not simply that it's not treating it. It's going to actually make it worse, just like giving that alcohol. You have a disease which is characterized by too much insulin. You're giving more insulin. You're not making it better. You're actually making it worse.
So the patient will gain weight and their insulin resistance will get worse.
Exactly. And the funny part is that the patients all know this. Because this is what happens, and I talk to a lot of patients, and they say, they go to their doctor, they start insulin, then they gain 15 pounds, 20 pounds, right? Which is, we all know that happens. That's not a secret, because insulin is what really drives weight gain. So what happens is that they take the insulin, they gain weight, and they go back to the doctor and say, Doc, what's this? You tell me I need to lose weight to get better. Then you go and give me a medication that makes me gain 20 pounds. This is not good. And the doctor always says something like, well, what are you going to do? You need to take the insulin, go exercise, right? But the problem is that it was not the lack of exercise that made them gain weight. It was the insulin that made them gain weight. So you need to treat that. You need to reduce it.
So what do you do? What do you do if you're a type 2 diabetic?
Well, the thing is that it's a dietary disease, right? And if you're a type 2 diabetic, it's a dietary disease. It's a disease of essentially too much sugar. So if you understand it like that, then the answer is to get that sugar out, get it down. So the first thing you need to do is cut out all the sugar, cut out a lot of these refined carbohydrates, which are just sugar. So the breads and the pastas, right? So they're all chains of sugar. That's all carbohydrates are, chains of sugar. As you eat them, they get broken down into sugar. So if you have too much sugar, if diabetes is essentially too much sugar, you got to stop taking sugar. Otherwise, you're going to make it worse. So that's probably the first thing. You can do more exercise, try and burn it off. And the other thing that you can do is try to do something more extreme, such as fasting, for instance. You can actually
more extreme than a strict low-carb diet. I love it. Okay, fasting. Tell me more about it.
So fasting is actually the most efficient and the most effective way to lower insulin. There's really no drug that does it. There are actually two, but they're not very effective to lower insulin. But if you understand that the disease is too much sugar, too much insulin, then you got to say, well, if it's too much sugar, too much insulin, let's get rid of the sugar, let's get the insulin down. How am I going to do that, right? So the thing about the sugar, you can go on a very low-carb diet, a ketogenic diet, and that will get your sugars down. But it doesn't necessarily get your insulin down because the proteins and the fats still raise insulin. Not to the same degree that carbohydrates do, but they still raise insulin. So you can get that sugar down, but you won't get that insulin down. So you can actually put people on various periods of fasting because you're not taking anything It's not simply low carb, it's low protein and low fat, right? It's nothing at all. So think about what's going to happen here. The body is not going to have anything coming in. So what it's going to happen is it's going to start burning that sugar. And that's perfect. That's exactly what we want it to do. It starts burning sugar. After it burns the sugars, your sugars come down. You don't have to take medications. You don't have to take insulin. After that, it starts burning fat. And that's perfect. That's exactly what we want to do. And there's always two questions that come up when you talk about fasting. One, can I do it? And the thing is, you have to understand is that literally billions of people around the world fast on a regular basis through their entire lives, right? So the Muslims, the Hindus, the Buddhists, the Catholics, almost every major religion in the world prescribes fasting. Not because it's super harmful, because it's very beneficial. And what happens during the fast is that your insulin levels go down. Perfect. That's exactly what we want. So what we're doing is we're burning off all that sugar and getting it out of the system, right? As opposed to just getting it out of the blood, we're actually getting it out of the entire body. So the fasting does both things. It lowers the insulin and it lowers the sugars. The other thing that always comes up with fasting is it harmful? And this is what always comes up. Am I going to go into starvation mode? And what's interesting when you look at fasting is that studies of fasting show the exact opposite. You don't have less energy, you have more energy. So there are certain things that get activated when you're fasting. So growth hormone goes up, for instance, to preserve lean muscle. Then you'd start burning just fat. Adrenaline goes up to give you more energy. And you're fueling all that energy with fat because you can measure free fatty acids in the blood and they go up. So what's happening is that you're burning fat, you're preserving your muscle, and you've got plenty of energy. Perfect. That is like the perfect treatment. What happens is that the diabetes, they tell you, is a chronic disease. So this is what happens, and this is what happens in all studies. And if you've taken medications, you know this is what happens. So your sugars start out actually not bad. As you take the medications, the sugars actually comes down a bit. But over the years, the effect sort of wears off. So then you wind up having to add more and more and more medications. So what happens is that no matter what drug you take, so these compare 3 drugs, metformin, glyburide, and rosiglitazone. So no matter what drug you take, the initial effect is very good, up to about 6 months. And then after about 6 months, the effect kind of wears off, and you can see that the sugar slowly goes up. And so what happens is that you wind up on a second medication or a third medication. And this is pretty well what happens to everybody. So if you've had diabetes for a while, and many people have had it for 10, 12, 15 years, what you find is that you start off on metformin, then you go to metformin and glyburide, then maybe 3 agents or 4 agents, then you wind up on a little bit of insulin, then you wind up on more insulin and more insulin. And if you think about the diabetes, if you think about who has, mild diabetes and who has severe diabetes, you can see that the people who are just on the little bit of metformin have mild diabetes, and if you're on a lot of insulin, you have very severe diabetes. So in fact, over these years, despite what everybody tells you, your diabetes is just getting worse and worse and worse. So your sugars might go up, they might go down, but your diabetes is actually getting worse. And I think that's what confuses people a lot, because they think that the sugar and the diabetes are the same thing, but they're actually not. But over that period of time, you can see that no matter what, it's actually progressing, and they say it's a progressive disease. So this is the thing that you have to understand, that the sugars and the diabetes are actually 2 different things. So diabetes, the real heart of diabetes is the insulin resistance, okay? So that part is what's getting worse. The sugars is really just a symptom of the insulin resistance, okay? But it's not the actual diabetes. The actual diabetes is the resistance to insulin and the subsequent very high levels of insulin. If you want to think about it, in a analogy, you can think about an infection. So if you have an infection, say you have a big, infection in the lungs or whatever. That's the actual disease. The symptom is the fever, okay? So what you have to do is treat the disease, which is the infection, with antibiotics. You can't treat the symptom of the fever. So if you have a very bad infection, you need antibiotics. You don't need more and more Tylenol. So diabetes is the same thing. The disease is about insulin resistance, but the symptom is the high blood sugar. And yet all our treatment is directed against the high blood sugar. So you can see that controlling the high blood sugars actually doesn't do anything for you, because you're not actually treating the disease. The disease actually continues to progress. And that's the real problem. So up to about 5 years ago, we thought that treating the sugars would make you better, right? And this is what probably all of you have heard. Your sugars are doing fine, your sugars are doing fine. So if you think that the sugars is the same thing as the diabetes, then you think that the diabetes is doing fine. But it turns out about 5 years ago that they did 3 very large studies, and what they found was that no matter if your sugars were well controlled or poorly controlled, it actually didn't make any difference. You still got complications of diabetes, you still got the disease, the heart disease, the strokes, you got the eye disease, the kidney disease, all of it. So none of that was made better by controlling the sugars. And if you think about it this way, you can see why. Because you're not actually treating the disease. You're only treating the symptoms. So just like if you take Tylenol for an infection, it might make you look better, but it doesn't actually make you better. So this is the same thing. So the diabetes is the insulin resistance. So you have to understand what is the cause of the insulin resistance, and then you actually have to treat it. So you have to treat the insulin resistance and not the sugars. Now, at a certain point when your sugars are very high, yes, you have to treat it. But that's not what is really important in the disease. The real heart of the disease is the insulin resistance. And because they don't really understand what causes the insulin resistance, they can't actually treat it. So all your treatments, all the metformin, all the glyburide, all the insulin, all of that is aimed at simply treating the sugars. So here's the real question. What causes the insulin resistance? And this is what's happening in the body. This is just a cartoon. So normally the insulin causes you to lower the blood sugars. That's what it does. As you eat, your blood sugars go up and insulin is released to take that sugar out of the blood and into the tissues. And that's a normal thing. When you develop insulin resistance, the insulin doesn't seem to work as well. So what happens is that the body kind of pumps up the levels of insulin to make it work well enough to get your sugars out of the way. But the high insulin level is a result of the insulin resistance. But what causes the insulin resistance in the first place? And that's really what you need to understand in order to treat it. Because if you know what causes the insulin resistance, then you can treat it. And it turns out that it's actually the insulin that causes the insulin resistance. And that might seem funny at first, but in fact, that's what happens in most biological systems. So if you look at any other hormone, if you get exposed to it, your body develops resistance to it. So if you look at addictive drugs or alcohol or anything, or smoking or anything, as you take the first one, say for instance marijuana or cocaine or one of these addictive drugs, or you can take Valium or any of these antipsychotics and stuff. As you take the first one, you get a real high, but every subsequent one is a little bit lower. So you wind up having to take higher and higher doses to get the same effect. And that's really resistance or tolerance, and it happens for all drugs. Insulin is exactly the same. As you take more and more insulin, your body develops more and more resistance to it. And now you see that it's actually a real vicious cycle, because what happens is that if your insulin level is high, then you get some insulin resistance. As you get insulin resistance, you get higher insulin levels. As you get higher insulin levels, you get higher resistance, and it goes round and round. So you have a vicious circle. And in fact, treatment with insulin now is not simply not effective. It's actually making things worse, because you're feeding into that cycle. So while the insulin lowers your sugars, it is actually raising your insulin resistance. So in fact, it's making things worse. You're getting more diabetes by taking the insulin. And that's the real problem. When you understand the actual disease, you can see why current standard treatment is actually not only not effective, it's actually really, really, really bad for you. Because you're treating the exact, what is actually causing the disease is what you're treating it with. That's never going to work, right? It's just not going to work. So if you think about it, the problem is that the insulin level is too high. So you're not going to make things better by taking more insulin. It's like treating an alcoholic with alcohol, right? This is exactly the same thing. So the same thing happens in alcohol. If you take alcohol, the first one you get, a real buzz, and then every subsequent one is a little lower. And what happens is that if you take the alcohol, you feel a little bit better. But you're not making the alcoholism any better, right? This is the exact same thing. The problem is that your insulin levels are too high. So how can taking more insulin possibly be good for you? And the truth is that it wasn't. It was never good for you. In fact, it made things worse. But people didn't really understand that. And because they didn't understand that, they then made an excuse for themselves by saying that this is a chronic progressive disease. But the truth is that diabetes was not a chronic progressive disease, because we know that we can cure it in many cases. So if you do weight loss surgery or gastric banding or bariatric surgery, basically if you staple somebody's stomach, their diabetes goes away in like 90% of cases. So this was not a chronic progressive disease. This is a curable disease. So if you say that this is a curable disease, yet our treatment is making people worse, the only logical conclusion is that our treatment is completely incorrect. And that's exactly what it is. So when you're thinking about treatment of diabetes, there's a few things you have to consider. One, you have to understand that the key to treating diabetes is not to take more insulin. That makes things worse. The key is, how are you going to get those insulin levels really low? The second thing is that diabetes is a dietary disease, okay? Almost for sure it's a dietary disease. We know that. Yet, if it's a dietary disease, the cure is going to have to be dietary. You can't take a dietary disease and treat it with drugs and pretend that that's going to make things better. But yet that's what we've done. We've taken a disease which is dietary in nature, and we've prescribed you drugs that suppress the symptoms. It's not going to make it better, and it hasn't. The last 30 years has borne it out. The third thing is that this is not a chronic progressive disease at all. This is in fact a curable disease, but you have to treat it the right way. You have to understand what you're doing. So one of the things we do in our clinic is that we are looking at ways of how to lower the insulin levels. And that's the real thing. And one of the simpler ways to do it is intermittent fasting. And that's why we have a lot of people on these sort of protocols. And one of the things to remember is that fasting has been done for many, many years. Everybody thinks that it's so crazy. Everybody hears about it at first and thinks it's crazy. But you have to remember that fasting has been done for thousands and thousands and thousands of years. And not only that, but almost every single major religion in the world has periods of fasting that are prescribed. Not because, of any particular reason, but they recognize that it is actually a very healthy thing for people to be doing every so often. And why is it so healthy? Because what happens is that when you fast, your insulin levels go down very low. Because you're not eating, your insulin levels go down. And having periods where your insulin level is down helps prevent that vicious cycle, right? It's the insulin that leads to the resistance, which leads to higher insulin. It's a vicious cycle. So if every once in a while, you do Ramadan, which is a month of fasting, or you do, the 40 days of Lent, or whatever it is you do, if you have a period now where your insulin level is very low, you're going to completely break that vicious cycle. And if you do that routinely through the year, then you will stay healthy. You will prevent the development of that resistance. If you don't get the resistance, you don't get the high levels. And that's what we do. So I'm going to show you here what we do kind of in a demonstration. So what we do in terms of the sugars, you can think about it this way. The body actually has the ability to store energy in two ways. So when you eat, you're taking in energy as food. right? So you can store that in two ways. You can store sugar and you can store fat, okay? So sugar is stored in the liver as something called glycogen. And there's really a limited amount of glycogen that you can store in the liver, but it's readily available, okay? So it's kind of like a short-term storage, but you can store sugar. If you store more energy than that, the body will actually turn that into fat, and that's kind of long-term food energy storage, right? So as long as you're eating, you're going to be burning that off. You're going to be increasing insulin, and insulin is going to tell your body to store some of that away, okay? So if you have too much sugar, what happens is that some of that is going to go into the stores. But as long as your stores are not full, it's not going to spill over into the blood. And what I'm going to do is I'm going to demonstrate it this way. Normally, as you take a little thing to eat, if you don't have filled up stores of sugar, what's going to happen is that you're going to fill it up a little bit, right? But it's fine. As you don't eat, so for instance, you eat dinner, you take in more calories than you can really use for that period of time. So your body produces insulin, and insulin says to the body, okay, well, I've eaten a big meal. I'll use a little bit of that as energy. The rest I'm going to put in storage as sugar, okay? Because that's what I do. So it fills up the storage, but the storage is empty, so it's fine. Then you go to sleep, so for the next, 9, 12 hours, you're not eating. So what happens is that your body is going to take that and it's going to burn it off as energy. So that's fine. That's the normal situation. Now what happens in the diabetic situation is something like this. So over time, your storage is, empty. But over time, as you kind of continue to eat more and more, what happens is that that storage kind of gets filled up. And now here's the situation in diabetes. This is your storage levels of sugar, right? They're completely full, right? And what you do when you eat is this. You're going to take in a meal and you're going to have more sugar. And what's going to happen? It's all going to spill over into the blood, right? So the blood sugar levels go up. There's nothing it can do. It can't store anymore. So for a while your body can compensate, but what does insulin do? So now you're diabetic, and this is what happens every mealtime. Your storage is filled up. Every time you eat, the sugar spills out into the blood. Well, as you take insulin to take care of that problem, the body is going to take that excess sugar and force it back into the body. So what happens to that? Your body is just going to store it as fat. In other words, this insulin is going to make you gain weight. And if you've ever taken insulin, you know already that's exactly what happens. But this is the problem. If you continue to do this day after day, year after year, all you do is gain weight, right? But it doesn't make you any better because all that sugar is still in your body. So it's kind of like that show Hoarders. I don't know if you've seen it, but people, hoard too much stuff and their house is full of stuff. So pretty soon the stuff flows out. And what happens? If you're taking insulin, all you're doing is taking all that garbage and shoving it back into the house. Well, that's not going to help. That's not going to make things better. In fact, over time, it's just going to make things worse. And that's exactly what happens in the current treatment of diabetes. So this is what we do instead. If your cup is completely full, the only rational treatment for diabetes, so this is the situation now in diabetes, your cup is completely full. The only way that's going to make you better is to start draining it off. So that's what you do. So as you fast, what happens? A little bit of this water is going to come out and it's going to get burned off. The next time you fast, a little bit more of this water is going to come and it's going to get drained off. Every single time you do it. So when you eat, it will fill back up a little bit, right? But as you go, what's going to happen is eventually your stores are going to come down and it won't spill over into the blood. You're basically just forcing the body to burn off that sugar. But as you do, you reduce the stores of sugar and you get better. Your diabetes gets better because now you're burning it off. It's like that guy in Hoarders. Instead of shoving it back into your house, which is what the insulin does, we're just going to throw it out. And really, that's really the reason that we do this. You have to lower insulin levels, but you got to get rid of that sugar. Okay? You've stored up too much. And it hasn't been stored up over like a month. It's been stored up over like 10 years, right? So the thing is that it's not going to reverse in a week or a month or 2 months even. Yes, if you do fasting every day, it will reverse faster, right? Because you're getting rid of that sugar every day. So this is what we do. And a few patients actually have been kind enough to share their stories with us. But I'll present a few other cases because we've had quite a number of people go through the program. So I'll just share their stories with you quickly because really it illustrates really how powerful this new concept is. So the first case we have is Richard, who's here today. And so he's had diabetes for about 10 years now, and he's had a few complications, including some kidney disease, which is why he was here in this office. And he saw a colleague of mine, Dr. Ting, and so he was referred into the intensive dietary management program, and we started him in June of 2013. And we started him with a fasting regimen as opposed to the amount of insulin that he had. So this is Richard and his wife. Oh, you can't see that very well. And this is what's happened to his weight. So his weight, starting just above 250, has been steadily coming down. And it's down to 210. His waist size has continued to come down. And his hemoglobin A1C, which is the measure of his sugars, has stayed relatively stable, below 7%. And this is him now. So if you look at what has happened to his insulin dose, so he started off with 55 units of insulin, and within 6 weeks he was off of all his insulin. In other words, his sugars are doing fine, and he's off of all his medications completely, and his levels of A1C are no longer at a level where you could make this case that he is diabetic. In other words, you could say that his diabetes has been cured. By using these kind of simple understanding of diabetes, you can see that this is actually the rational, but also the natural way to cure diabetes. We're not talking about piling on more drugs for you. I mean, you go to some of these places, they'll tell you to take these experimental drugs and they want you to sign you up for drug trials. No. What we're doing has been done for thousands of years and is in fact exactly the way they used to treat diabetes. But they understood that it was a dietary disease. It has to be treated with dietary measures. This is the second case, Balraj, who's here this morning as well. So he was diagnosed in 2003 with diabetes, and he also had some complications of that. And so, after treating him incorrectly for many years, I started him on the intensive dietary management program because back then I didn't understand much of this myself. Much of this is new. So he started in August, and so his weight has come down a bit. But, he started at 186, and he's come down, 8-10 pounds or so. His waist has come down, but you can see his sugars, his hemoglobin A1C has stayed very good. And this is his medications. So again, starting at over 40 units, about 40 units a day of insulin. So this is what he had to take. Within 5-7 weeks, he was down to 0. He is no longer taking insulin. He's no longer taking any medications for his diabetes. Which again, you could say, if your sugars are good and you're no longer on any medications, you could say that your diabetes has been cured. In essence, what we're doing is exactly the same thing we do with the stomach stapling surgery. So the stomach stapling surgery, the cure rates for diabetes are like 90%. But the benefits are because of the fasting. They cut your stomach so you can't eat. In other words, you're fasting. But if all the benefits come from fasting, why do the surgery at all? It doesn't even make sense. Just do the fasting. This is another case. He's not here, but he's a 45-year-old Filipino man, and he was just recently diagnosed with diabetes. He started with a hemoglobin A1C of 8.7%. So anything over 6.5 is considered diabetes. Anything over 7% is diabetes, but he was newly diagnosed and he really didn't want to start any medications. So I said to him, well, if you don't want to start medications, then come into my program and we'll treat you. And we'll treat you, and therefore you won't have to take medications. So it had been slowly rising over the last 6 months, and what happened was that he started in June. His weight, again, came down. It came down about 3 kilos, but his A1C continuously came down. So you can see that his final A1C at the end of 10, 12 weeks was 6.3%. So again, at a level that you wouldn't be able to say that he has diabetes. So in other words, this fellow, instead of taking medication and then later taking more medication, then more medication, then more medication, we're able to treat him right off the bat with a dietary regimen, and he's been able not to take any medications. In essence, his diabetes has been cured. So again, lots of cases. Another fellow, 66-year-old Chinese man, much the same story. Type 2 diabetes, which was recently diagnosed in 2012, and you can see that his sugars were really high. His A1C was 10.5%. I told him to try different things, but I just saw him actually in September of 2013, and his A1C was still 9.4%. And he didn't have a drug plan, so he really didn't want to take any medication. So I said, well, if you don't want to take medications, come into the program, and that should say September 2013. So we started him a few months ago, and this is what's happened. So as he's following the program, his sugars are coming down. Exactly what we would expect. And as you follow the program longer, you're burning off those stores of sugar, and your hemoglobin A1C is coming down. So he went from 9.4 to 8.4, and I just saw him at 7.3. So again, all without medications, and I'm hoping that he will never have to take medications. Another case, Desmond, he had some heart problems. He also had diabetes, and he's here this morning as well to share his story. He also had a bit of complications, the heart disease, the neuropathy. And this is what we did. Again, with diabetes, it causes all kinds of problems, right? So you get heart problems, you get kidney problems, you get eye problems, all kinds of problems. And the thing about it is that there's nothing we can do about those kidney problems or those eye problems because it's the diabetes which is killing the kidneys, the heart, and all that sort of thing. If you don't do anything about the diabetes, you can't do anything about the kidneys or the eyes or anything else because the root of the problem is the diabetes. So you have to take care of the diabetes. And the way that we had been treating him was making the diabetes worse and worse. So we started him on the program, and again, his weight has been slowly coming down. As you might expect, his waist size has come down, and his sugars actually have stayed very, very good. But if you look at his doses of insulin now, again, starting at about 25 units a day, we're able to bring him down, and now he's no longer on any insulin. We switched him instead to one of the pills, which is, for many reasons, is much better. It's safer, it's much less, you don't have to poke yourself all the time, you don't have to check your sugars all the time, but really he's been able to come down of all those medications. If your medications are coming down, you're coming off of the insulin, you're going on to pills instead, it means your diabetes is getting better, right? Before, every single year your diabetes was getting worse. And now, for the first time, we see everybody's diabetes getting better. It's reversing because instead of having higher insulin levels leading to higher resistance, now we have lower insulin levels leading to less resistance. So you're actually driving that cycle now in reverse. And that's why it's working so well. And that's just a recent picture of him now. A couple more cases. So Frank, who couldn't be here, we asked him to be here, and he said that I think he was away, so he couldn't come, but he did want to come. He also had diabetes and kidney disease, and he actually didn't really want to start. He calls himself a grumpy old goat because he didn't really want to start. He didn't think it was great, but I kind of talked him into it. I said, you really should try it because there's nothing to lose by trying it. If you don't like it, then you don't do it. But we were able to start him on the program, and you can see here again, his weight is coming down nicely. His waist size is coming down. His sugars are improving almost every single time. And if you look at his doses of medication, again, he started on 45 units a day of insulin. by the time we finished with him, he's on no insulin, and he's just taking a pill. So again, you can see that his diabetes is getting better. His sugars might go up and down. So the sugars actually get better as you treat the disease. Just like if you treat with antibiotics, your fever goes away because your disease is getting better. You don't have to treat with Tylenol, because if you get rid of the infection, the symptoms go away. It's the same with the diabetes. As you treat the diabetes, the high sugars goes away, because the high sugars was just a symptom. You can't treat the symptoms and expect the disease to get better. But as you treat the disease, the symptoms get better. So everyone here, their sugars are coming down. We're not treating the sugars particularly, we're treating the disease. Another fellow who is here, I follow for high blood pressure, and I've seen him for quite some time actually. And he was also diagnosed with type 2 diabetes as far back at least as 2004. He'd been on insulin since 2007, and his main problem was actually high blood pressure. But I said, well, you know, high blood pressure goes along with the whole metabolic syndrome. So in fact, the diabetes and the weight and the hypertension and the high cholesterol, they're actually all caused by the high insulin level. So I said, well, with this high blood pressure, we need to do something. So I said, well, we need to get you into the program, because he was on probably 8 different medications for high blood pressure, and his pressure was still like 200, right? So we put him in the program, and what happened to him, his insulin levels, his insulin dose went from 70 units a day to right now 0. He's just on some pills. That's fantastic. That's fantastic. His blood pressure is getting better. His blood sugars, again, they go up and down. We can see that they're all within the normal range. But we went from 70 units of insulin a day to 0 in less than 3 months. So 5 years of insulin that he'd been taking every single day. Not getting better, getting worse. Over time, it just gets worse. But now it's starting to reverse finally. And another fellow who isn't able to come, but we call Mr. Yes, he much the same story. He had been on insulin for many, many years. And as everybody here, he started with a medication, then he took more medications, then he took insulin, then he took more insulin. By the time they were done with him, he was on 140 units of insulin a day. And that's not even that unusual. I see lots of people with that kind of high dose. So as we got him into the program, his waist size was coming down, his weight is coming down, his sugars are getting better, and he's not completely off insulin, but he's down to about 30-40 units a day. So from 140 down to about 30 or 40. So significant improvement. I mean, because he started so high, it's going to take a little bit longer. But again, you can see that as you continue to do it, it gets better. And this is Robert. He's also here this morning, but he's done extremely well again. So the same story, type 2 diabetes, treated with medications and more medications and more medications. Finally, they put him on insulin, and then I recently saw him and I said, whoa, insulin, now this is not good news, right? So I said, forget that. We need to get you into the program. We need to get you treated correctly, because if you're not treated correctly, I've seen this movie before, it goes insulin, more insulin, more insulin, more insulin. In fact, his insulin dose went very quickly up to close to 40 units a day. So as we got him started, his weight started to come down, his waist size came down, his sugars got better, and look, within 3 weeks, he was off of all his insulin and just taking medications. Now we're working on getting rid of the rest of his medications. So that is the power of being able to treat it correctly. And these are not isolated cases. We actually see responses in the majority of patients, because we're doing the things the right way. If you do it the wrong way, you'll never get any benefit from it. And that's what we've been doing all along. So the key here really is to lower insulin levels. And there's more than one way to do it. We use intermittent fasting because it's a very simple way to do it. But there's actually a number of ways to reduce insulin, because that's really the key. The insulin is what causes the diabetes. What's interesting also is that the insulin causes obesity. And that's why they go together, because they have the same cause. They're both caused by the same thing. So whether you're here for weight loss or whether you're here for diabetes, they're both caused by the same thing. They're diseases of too much insulin. And if you understand that they're diseases of too much insulin, now you can say, that's good to know, because now I need to know how we're going to reduce the insulin levels. That's the key. So intermittent fasting is one way. The second way is to reduce your dietary refined carbohydrates. So carbohydrates tend to raise the insulin levels very high, and therefore they're something that you should reduce. There are also several protective factors. So there are factors that protect against the rising insulin. And one of those is a high-fat diet, which is very interesting because for many years you've probably heard that you should eat a low-fat diet. And what I'm saying is actually that wasn't good for you at all, because the fat actually helps protect you by keeping those insulin levels down. Fiber does much the same thing, so high fiber diets also help protect against the rise in insulin. Vinegar, so many traditional foods are very high in vinegar, pickled foods and that sort of thing are protective. And certain spices may also benefit, so cinnamon and turmeric and certain other spices may also have a role in protecting. So some people take other extracts like bitter melon juice, and that's the same sort of thing. There are probably natural compounds which also help protect against the rising insulin. But the key is, whatever way you do it, it's all done in the same manner. It's to reduce insulin levels. So you can do it with fasting, or you can do it with these very low carbohydrate diets. Now the one question that everybody always asks about the high fat diet is that, isn't that going to clog up my arteries? And that's what we've taught you about. Oh, before I forget this. So this is the hormonal obesity theory, which is what it's all based on, which again, the real key is the insulin levels. So insulin levels, these are protective factors, but it's all to do with this vicious cycle between insulin and insulin resistance. Fructose, carbohydrates, wheat, they all play into the high insulin diet that we all eat. And that's one of the reasons that we're getting the obesity crisis, the diabetes crisis, is because we have a very high insulin sort of a diet. Processing is what's really bad because it strips out the fat and strips out the fiber, so you're taking out these major protective factors, and therefore you're leading to increased insulin levels. And that's what we have to combat. The insulin leads not only to the weight and the diabetes, but also a whole list of things, which then leads to the heart disease, the cancer, and all these other things. So